Hey, well, welcome everyone to the sponsor room and welcome Dr. Shore after that awesome lecture. I'm excited to talk a bit more about the ZEISS SL800 slit lamp and really how that can help our optometric patient care and our co-management with ophthalmology. And so we'll go ahead and get started. If you could answer for us how optometrists can use the SL800 to better co-manage refractive surgery patients with ophthalmologists. Dr. Shore, you're muted. I'm sorry.
Is that for me?
Yeah.
I'm going to talk about that. I'm giving a talk actually, and I'll get all into that, into the weeds on that question. So stay tuned for that. But it's a great slit lamp. Basically, I'll be talking about how the technology and the optics really enhance our ability to communicate with other providers.
Oh, sure. Oh, is that talk later on or?
Yes, yeah, we're doing that right now after a little short video.
Oh, terrific.
Yeah, it's
We
part
can
two.
go. Yeah.
I think we're. Oh. Someone's supposed to show a video, but I can give the talk now if we need. Did we lose our host?
Oh, no, I'm here.
Um, I thought they were going to present that, but yeah, I can give my.
Oh, here
Oh,
we go.
here's
I think we got it
here
going.
we
Yeah.
go. So this is just a little short video on the SL800. It's 5 minutes, so bear with us.
We're here in the beautiful ZEISS Innovation Center in Dublin, California. I came here specifically to show you guys real time the magic of this slit lamp. Again, it's amazing. I bought 3 of them for my new clinic, which focuses on refractive surgery and cataracts, and this is a game changer for me. So I'd love to show you the ropes. So I've always been a huge fan of technology, of special lenses, anything we can do to make our examinations and our patient evaluations better. I truly believe in. This is our workbench. This is where we examine the patients, identify pathology, look at our surgical results, and do our surgical planning. So it's super important to have the best technology. It's sleek, it's modern, it's white, so it really goes with all the aesthetics of the office. So I think that makes a difference for patient experience. And I think that our modern technology and our modern equipment is reflective of the care we provide today. So I'm going to walk you through the slit lamp, the features. So the first thing to notice is this technology right here. So this is kind of the most exciting part of the slit lamp from an operational standpoint. There's an automatic lock button, so you can just lock it right away. If the patient's moving, if you have to show them some imaging, you can lock and unlock right at your fingertips. So it's unlocked and locked. Really awesome feature. Another really nice thing is the illumination is right here at the base of the slit lamp, so you can go from low illumination to high illumination with just the flick of your finger. And you can also go for mag increase with your fingertip. So it makes everything really easy to use and really accessible, and you're not kind of like moving all around the machine, which is awesome. So I'm going to show you going from low mag to high mag at your fingertips. This is the beam height adjuster right here with an illumination on that number, so it makes it really easy to capture that value. And you can see a really nice optical quality. Everything's bright, everything's visible. And I'm gonna toggle that mag. So I want to mag out and mag in. So one of the really nice features of this slit lamp is that if you're examining a patient in a dark room, there's an illumination on the sides of the beam. So if you're trying to measure a corneal ulcer or an epithelial defect in a dark room, you can see everything right at the top of the slit lamp, and you can toggle between the different filters. So you have of course, your blue filter for checking epithelial defects or dry eye, and then you have your LED, nice bright crisp light with the bright white color. If you want more of a diffuse, softer illumination for light sensitive patients, you can see this halogen light here. Here, this part of the slit lamp right here is where the camera attachment is. It's connected with the optics, so it's really cohesive, built in and integrated. And the nice thing is, if you want to take a slit lamp photo, you can just press this button with your pointer finger. One click for a photo. If you want to look at your beautiful LASIK flap or some stria, one click, and everything uploads on your monitor. And then, if you want to go higher mac, you can. The nice thing is, if you want to take a video, real time, you hold the button down, long press, and you've got video action, which is so cool if you're teaching, if you're preparing presentations, or if you want to communicate with an ophthalmologist about a finding. It just makes the image come to life. So I'm going to go lower in the magnification. Then again, you can send this video to the ophthalmologist you're working with, and kind of go over some of the pathology or the findings. Makes communication so much easier. So here you have your application tonometer. It's just works really well. It's smooth. And one cool feature is you can tilt this whole structure in order to bend the light. It makes gonioscopy much easier. So that's a very cool feature, and it's really easy to do. So ZEISS was built on the quality of its lenses. So this company does lenses better than anyone else. And these optics are really special. They have an apochromatic coating. It makes it anti-reflective and really easy to get a crisp image. Okay, there's my beautiful iris. I'm gonna get a nice picture of this. I'm gonna go up to the high mag. We got a nice slit beam and a video of this tear film. Okay, so that's a tour of the SL800. It's amazing, great technology. I've really enjoyed using it in my own practice. And let me know if you have any questions.
Okay, so that is the magic of the slit lamp. I'm going to share my screen now. Tell you a little bit more. Can you guys see that?
Not yet.
Oh, hold on. Now, can you see
There
it?
we go. Perfect.
Okay. We'll be experts by the end of the night. So this part is the ZEISS, where I can talk all about ZEISS openly. I obviously, as you could tell, I'm a ZEISS girl. I've used their microscopes forever, and a lot of their diagnostic equipment, and just think they do things really well and with a lot of pride and precision. So I want to talk to you about I am a KOL for ZEISS, just a disclosure, but that's because I believe in it. So I want to talk about sharper optics, smarter exams, unlocking the power of ZEISS optics. So it's a great module. It has, as you saw from the video, premium optical quality with a lot of comfort and ease, high def images and video capture, workflow optimized design, and digital documentation. So it's a slit lamp, but it's a good one. Hold on. So this is our workbench. You probably got the sense from my other presentation that our tools are really important to us. I really think we're only as good as our diagnostic tools and our microscopes. I've always been put a lot of emphasis on this, and ZEISS is amazing. It began in the 1900s, and they developed the famous Gullstrand slit lamp. They do create ski goggles, telescopes, OR microscopes, cameras. They're really doing it all, and they have innovated and created this great new slit lamp. So some of the features are the TrueView optics, the VarioLight, and the Auto View, and I'll talk to you a little bit about those. So the optics are amazing. They're larger lenses. They're apochromatic lenses with anti-reflective coatings, which reduce glare and make the exam easier for physicians and ODs. They have optimization of the colors, so they reduce aberrations, and anti-reflective coatings. These are some of the filter options. You've got the LED light source plus the halogen filter, which gives you the advantages of both light types. And it allows you to see clearer images and sharper images with a more natural color of what you're looking at. So here you can see the cold white of the Vari-Light, and then the warm white, and then the green and blue filter, and the red filter. Depending on what you're looking at, those come in handy. So as you saw in the video, the operator control is really great, because before I'd have to lift my hands up and move my elbow and shift things, and then the patient's moving. If you can just do everything at your fingertips, it makes it a lot easier. So you can control the joystick, and the magnification is right there. Magnification. The brake is really handy, and also if you leave the slit lamp, it'll automatically go into eco mode, so it saves on your light bulbs. And this is a proponent of the slit lamp. He said, "I've used many slit lamps throughout my career, and this is the best one I've experienced. Thanks to the excellent optics, I can easily see details which are difficult to see." And he just really is a proponent of the slit lamp. So, and I actually discovered the SL800 when I was visiting one of my colleagues, Dr. Krishna, in Houston, and he had them in his office, and I was just shocked, because I thought, other options were the gold standard, and I was really surprised and impressed. And the imaging is really seamless. As you saw in the video, you capture the image and the videos, and they upload straight to your EMR. It's modular and it's compact. And the video quality is incredible. It's just very high def, 18 megapixel camera with resolution, true to life color, so you're not looking through skewed colors like some of the other devices. And there's no latency, so it's just live and happening real time. And we talked a bit about this. So you can take a video and then collect still shots from that video, which is really cool. So you can kind of pick which images you like the best. If you have an ulcer and you're getting a slit lamp photo, video, you can just kind of do it until you're happy. And then documentation is really easy. You can export to forum from ZEISS and DICOM systems or to hard drives. And how does it compare with other slit lamps out there? They have the apochromatic optical system versus others that are chromatic. The Vari-Light is a game changer, and the magnification is great with the mechanical and the auto view electric. The brake is really nice. It's electronic and super quick and easy to use. Where some others you have to twist that little knob to brake the machine. And the camera is really, really high quality with 18 megapixels versus most are 5. And you get 40 frames per second versus 5 with the competitors. And the image trigger is right on the joystick, so it's just very easy to get. So if you're looking at really specific corneal pathology or iris pathology or whatever, oftentimes you have a second to capture that. You don't want to go fumbling around for the keyboard. So pictures are worth 1,000 words. I wanted to show you some images. This is a nerve head taken with SL800 imaging. And this is an iris nevus, corneal scar. Corneal scar, and also a nerve. You can see the LASIK flap edge and the corneal nerve there. Here is the nerve, and here is the LASIK flap edge. This is PCO, posterior capsular opacification, on the back surface of the lens. So just really amazing quality. That's with retroillumination. And this is an epithelial ridge after corneal injury. So the epithelium has healed in, but you see these irregularities that stain with fluorescein, and you're capturing that with the blue light. But it's just really, really high def. And this is a video captured with that machine. So you can just see it's just good. Easy to see the features. It's not blurry. It's well focused. You can scan. This was a normal healthy eyeball of one of the ZEISS guys, but you can see the slit beam here. So Yeah, so it's great technology. As you know, optics are everything. I made up this quote, but in ophthalmology, we're only as good as our tools. And so we really want the best to be able to provide the best care. And that's my contact information. So feel free to reach out with questions, and I'm around if you need me.
Thank you for that excellent presentation. There actually are a few questions here in the chat. If you're still have a few minutes, I'll share them with you.
Great.
Could you explain specular microscopy technique?
Yes, that is unrelated to this topic, but yeah, I'd love to. I'm a cornea girl, so basically you need a specular microscope. So that's a separate device, but it allows you to image the endothelium. So you can look at the endothelial cells, which are hexagonal shape, or sorry, yeah, hexagonal shape. And it's been a while since I did a DMEC, but yeah, and you can count the cells. It's just it's a great device, but it's separate from this.
And with this, the ZEISS SL800, are there any dry eye modules like my biography?
I don't believe there are, but you can definitely image, like use fluorescein and lissamine green and just image the sulcus and the tear film and how high up the tear lake goes. So you can look and you can look at SPK. So you can do a very thorough dry eye examination, but no mammography, as far as I know.
And then if you could comment on like specifically how optometrists can use the ZEISS SL800 to better co-manage refractive surgery patients with ophthalmologists such as yourself.
Yes, that I can answer that question. Yeah, that's I mean it's the game changer is the communication. So images are everything. A picture is worth a thousand words. So if an optometrist sees epithelial ingrowth or a little, you know, scruff in the interface or a fiber or the flap edge looks a little funky or there's just something that you want to ask about, it's invaluable to be able to send over those images and the videos because either it'll save the patient a trip or the patient can get started on treatment more quickly. So it's just being able to see and visualize and communicate is just so important.
And then what role does the ZEISS SL800 play in the preoperative evaluations, and how can ODs contribute to that process to make your job easier?
I think the biggest part is just doing a great exam and just like we talked about in the last talk, just being really aware of any pathology that exists, documenting if there's dry eye, if there's cataract, or if there's PVD, all of that, all of it is important in the preoperative assessment, and then coaching the patient, guiding them towards what might be a good option for them after they leave their office.
Seeing like the amazing image quality, both with the still shots and the video of the slit lamp. So I can not only imagine your answer to this question, but for postoperative care, how does the ZEISS SL800 assist in identifying complications or ensuring optimal outcomes?
Just being able to really to see and diagnose. So a microscria might be very, very subtle. It is very subtle. So to be able to retroilluminate and to have that great quality and not have the glare and to be kind of fussing around, to be able to see it and then to capture it and communicate it. So it's just being able to see the nuances. It's very, very subtle. It's a tiny 100 micron flap in the cornea, or the vault is very hard to image and visualize. But if you have a great slit lamp and good magnification, and then you can just take a shot of that vault and say, is this okay? The pressure is fine. I mean, that goes so far.
And are there specific types of cases or conditions, such as like dry eye, anterior segment pathologies, that you feel the ZEISS SL800 is particularly well suited for in the optometric practice?
I just think we're as good as our tools. And I think, I mean, obviously a lot of the slit lamp hog strike's amazing. It's good, it's our gold standard so far, but it's been known as being the gold standard. And there's a lot of options, Marco and all sorts of options. But it's just, it does, cost money, obviously, to replace slit lamps. And I'm not saying you should do that, but it's just nice if there's an old broken slit lamp and you're debating between two options, having one that is exceptional, maybe as you're in your photo room, that's the exam room that has the capability of taking imaging, that might be like you might have one of these and the others could be something else. But I think it's just nice to have access to this rather than fumbling around with like an iPhone and the ocular that
Yeah.
everything's moving and it's impossible. So it's just nice. I think it gives us a lot of reassurance that we're managing the patient well.
Yeah, I think improving the workflow process as well in a busy clinic setting, that you're not fumbling with your cell phone trying to take photos, is very beneficial as well. And what advice would you give to optometrists who are considering like upgrading to the ZEISS SL800 in their practice?
I think just start with one, depending on how many exam rooms you have. They're new, so unfortunately there aren't a lot of refurbished, but in the next coming years there should be some refurbished. That people either close their office or retired. But I think it just obviously it comes down to financials, and if it makes sense, obviously you can't get reimbursed from the exam, you get your normal reimbursement, but it doesn't increase with the ZEISS microscope, but I'm pretty sure imaging does get reimbursed, so that's a nice perk. But yeah, I just think depends on everyone's situation, but it's nice to have.
And last question here to wrap it up this evening. For those that already have the ZEISS SL800 in their practice, do you have any like tips or techniques that you'd recommend for them to get the most out of their slit lamp?
I think just getting in the habit of photographing. I think we just if we don't have a slit lamp camera, like at my last practice, we just didn't have one, so we just saw and measured and documented, but we just weren't in the habit of routinely documenting. But even things like a LASIK flap edge is nice to have in the chart because you could document if anything changed or if there was a melt or epi ingrowth. It's nice to actually have um, any sort of pathology just documented. So I think just getting in the habit is a game changer.
Well, thank you so much, Dr. Shore, for sharing with us your advice for optometrists and to ZEISS for exhibiting at this event. And, really excited to hear more about the SL800 slit lamp from ZEISS. I mean, amazing optics, amazing image quality. Really excited about how that can improve our patient care and really improve our surgical outcomes and our co-management with ophthalmologists such as yourself. Well, I want to thank everyone for joining us here in the sponsor room this evening and have a great evening. And thank you again to ZEISS.